Chiropractic and Immunity. Although many would like to frame the disagreement regarding the scientific evidence for chiropractic and immunity as one of simply semantics, it is in fact one of substance that affects patient care. The two elements that need to be understood to understand this difference is first, what is scientific evidence, and secondly, what is evidence that has clinical value and utility. We'll examine two different perspectives about the evidence related to chiropractic and immunity, and as we do so, we'll reflect on these two elements and how they fit into the arguments for and against. The first report is the effect of spinal adjustment or manipulation on immunity and the immune system, a rapid review of relevant literature published by the World Federation of Chiropractic in March of this year. This is a prestigious international group made up of clinicians, researchers, and other academic professionals. They felt the need to publish this rapid review simply due to the urgency over the spread of misinformation they suspected would occur with the COVID-19 pandemic. This was an attempt to caution the profession that little is known about the role of chiropractic manipulation and immunity, and to make several points: that there is little evidence, and what evidence there is preliminary and not reflective of any clinical benefit. This met with severe reactions from many groups within chiropractic, some not surprising, but some not predicted. Why? What one chooses to accept as scientific evidence. We'll look at this document and the counter to this document from the International Chiropractic Association to understand why. Here are the 7 studies in this review. Why not more? Because, as we will see, studies must meet certain thresholds of quality scientifically, which include peer review and publication, and frankly, they must be an actual study. In fact, the primary reference used as the main defense that there is an effect cannot be found as a publication in a journal, only as a presentation at a conference. More on that in a moment. Secondly, most of the publications were small study populations and most asymptomatic. There was no long-term follow-up on any measured changes, and in all cases, either the increases in measures of immune function were within normal physiological ranges, or there was no statistical difference between the two groups studied, chiropractic versus non. The first listed study was by Pero and Flezia. It's reported that in 1986, Dr. Ronald Pero, a professor of medicine and environmental health at New York State University, collaborated with Dr. Joseph Flezia, a basic science researcher and chiropractor. Reports state that subjects receiving chiropractic care had a 200% greater immune competence than those who had not received chiropractic care, and a 400% greater immune system competence than those with cancer or other serious disease. What the measures of immune competence were is unclear, but is apparently based on some specific biomarkers that I was unable to identify. And no one can actually find this study. It apparently has not been published, and it's been 34 years. For this reason, the WFC simply said they can't consider it scientific evidence. Let's continue with the study on interleukin-2. While there were increases of interleukin-2-induced IgG and IgM synthesis in subjects receiving spinal manipulation, the amount did not exceed the physiological range of normal human response. The authors state, quote, "The clinical significance of the elevated responsiveness to interleukin-2 demonstrated in this in vitro study is presently unclear. This study found a short-term increase in interleukin-2 with spinal manipulation with or without cavitation." Now to the study on HIV patients. This study sought to demonstrate whether upper cervical specific adjustments had an effect on the physiology, serology, and immunology of HIV-positive individuals. Many who use this study as support state that for those not treated chiropractically, there was an 8% decrease in CD4 cells over a 6-month period, while the group receiving real chiropractic adjustments experienced a 48% increase in CD4 cell levels over a period of 6 months. Yet the findings were that there were no statistically significant differences between the treatment and control group. This is a key point that many miss. The findings of studies are put through statistical analysis to see if differences could have occurred by chance. If so, they're not statistically significant regardless of the results, and it's particularly hard to accept this if the results support your belief. The level of chance is indicated by the p-value. And now, from a recent review of the literature on the effects of manipulation on the immune and endocrine systems, from the abstract, quote, the search retrieved 13 relevant articles and 2 themes of discussion were developed. 9 studies investigated the effect of SMT on cortisol levels, and 5 of them were conducted on symptomatic populations. 4 studies examined the effects of SMT on the immune system, and all of them were conducted on healthy individuals. The authors conclude that while spinal manipulation may stimulate the neuroimmunoendocrine system, the evidence supporting a biological account for the application of high-velocity, low-amplitude thrust manipulation in clinical practice is mixed and conflicting. It also concluded that the clinical relevance of most of the studies remained unanswered as they were conducted on healthy subjects. And now to the most potentially significant study that unfortunately was never actually published. In the study, it is reported that with 100,000 cases of influenza, the death rate was 1/40th of that reported using conventional medical treatment. We can see from this table presented in the ICA's report on immunity and chiropractic that several locations were compared: Davenport, Iowa, the state of Iowa, Oklahoma, nationally, and New York City. We see numbers that indicate a dramatic difference in death rates comparing MD to DC care. Again, the issue is this was never published. So without the verification of a peer-reviewed journal, unfortunately, there's no way to validate these findings. And so to the conclusion of the WFC report, quote, there is no credible scientific evidence that spinal manipulation or adjustment has any clinically relevant effect on the immune system. Available studies have small sample sizes and a lack of symptomatic subjects. At the time of writing, there exists no credible scientific evidence that would permit claims of effectiveness for conferring or enhancing immunity through spinal adjustment or manipulation to be made in communications by chiropractors. In the event that new scientific evidence emerges, it will be critically appraised using scientific methods of analysis. And now to the ICA's publication entitled Immune Function in Chiropractic, What Does the Evidence Provide? They state, the evidence does not exist because the research on COVID-19 in chiropractic has not been conducted, just as it has not been conducted on most other treatment options that might be considered as potentially helpful or for potential off-label use. At present, there are 44 clinical trials registered with clinicaltrials.gov for COVID-19. Not even one is for any non-drug, non-biologic approach. However, the authors must recognize that to conduct a study, you must develop a study, propose the study, and be funded for the study. And the proposal must reflect a hypothesis supported by basic science research. They also state, quote, the ICA has been clear that no claims can be made about COVID and chiropractic. Now, although the ICA often implies or states there are over 100 references to support the connection between chiropractic and immune system improvement, it is important to actually look at these references because if you're trying to support with scientific evidence the concept that chiropractic boosts the immune system, what doesn't count is the following. There were 13 osteopathic references. At least 20 are opinions and editorials or simply internet posts. Of the actual studies, at least 6 are listed twice. At least 5 demonstrated changes in endorphin production in relationship to patients with low back pain. And at least 25 are referencing non-chiropractic basic science sources regarding the relationship between the nervous system and immune system, not chiropractic, and the neuroimmune system. 2 of the most important ones cannot be found with regard to where they were published, and at least 16 are conference presentations. References are not always scientific evidence. It's not about how many references you have, it's about the legitimacy and level of quality. Here we can see the accepted hierarchy of evidence. It's based on a reciprocal relationship between quality and bias. The higher up the pyramid, the more scientific quality, the least risk of bias. And the reverse, as you go to the base, the lowest scientific quality and the highest risk of bias, which includes editorials and expert opinion. and just above that, basic science mechanistic studies which show relationships and associations, not clinical effect. Without being a scientist, a logical approach would be to compare two groups of patients. Remember, this is the key difference of a scientific approach where you compare a treatment to another treatment or sham or placebo. Otherwise, you don't know if your results are similar to natural history or another approach. This is simply not possible in practice. One approach is to indirectly study the physiological components of the immune response to see if manipulation causes changes and for how long in asymptomatic participants, and compare that to those not treated chiropractically to compare in particular to normal variation and natural history. Remember, though, that changes don't always transfer to benefit, and certain chemicals have different results based on receptors such as histamine, substance P, and serotonin. Not all immune responses are good. Think of anaphylaxis, other hypersensitivity reactions, and autoimmune diseases. In another clinical approach, the patients would be symptomatic for the same average period of time, and of course of equal severity, such as those hospitalized for infection. Then you would compare chiropractic manipulation to a group not treated chiropractically, but you would have to choose which chiropractic manipulation. Then you'd have to compare the event rates, which is how many people improve, and how long patients took to recover, and of course any differences would have to be both statistically and clinically significant. You can see how incredibly difficult this would be, and in a pandemic, even more unrealistic. Any consideration of the use of chiropractic would be based on some plausible hypothesis with some significant evidence prior to consideration. So although the sequence of confirmation could be in either direction, to be considered for treatment of a serious disease, the strength of the hypothesis and basic science evidence would have to be significant. Let's go through the process of thought presented in the ICA document. They state that historically we're based on trying to help the body respond appropriately to the environment, then a discussion of the historical context of Palmer, of immunity, and basic concepts including how immune function is measured, including T cells, chemokines, neuropeptides, substance P, cytokines, and interleukin-2. This proceeds to a discussion of chiropractic and the nervous system. Then a separate discussion of the evidence or the relationship between the nervous system and the immune system. They also state that anecdotal evidence is still evidence, but we've discussed where that falls on the evidence pyramid, given its susceptibility to bias and lack of scientific quality, such as a comparison to different groups. So what am I supposed to say to my patient? Utilizing the logic of the ICA rationale, you might state, because the chiropractic profession has always focused on the nervous system, and because the nervous system and immune system are interrelated, and because there are a handful of studies showing some changes in the chemicals or cells related to the immune system, and even though we don't know what that actually means for your immune system or response, I believe that I can help boost your immune system with chiropractic treatment. So let's frame this in the results of the WFC report. There are very few studies of chiropractic and immunity. They are small studies mainly on asymptomatic patients that only measure indirect changes after a single treatment. There are no published studies on symptomatic individuals over time to demonstrate a lasting effect that is different than for patients not treated chiropractically. You might ask, what if I think some of my patients do improve faster or have fewer infections? Then simply say so, but add that it is your observation. And if you actually keep data on patients to measure this, you might be able to demonstrate, at least for symptomatic patients treated by you, that there is or is not an effect. There's a rising concern among many chiropractors and researchers that a misinterpretation of science may lead to claims that affect patient care, which led to this publication, a unified statement of the global chiropractic research community against the pseudoscientific claim that chiropractic care boosts immunity, published in Chiropractic and Manual Therapies. Quote, the International Chiropractic Association posted reports claiming that chiropractic care can impact the immune system. These claims clash with recommendations from the World Health Organization and World Federation of Chiropractic. In their reports, the ICA provided no valid clinical scientific evidence that chiropractic care can impact the immune system. We call on regulatory authorities and professional leaders to take robust political and regulatory action against those claiming that chiropractic adjustments have a clinical impact on the immune system, unquote. In response, the ICA posted, quote, "The ICA has previously provided clear reminders to its members of the importance of not advertising in any form the suggestion that chiropractic care can cure, treat, prevent, or mitigate COVID-19 because the evidence to substantiate such a claim does not exist," unquote. But of course, they didn't deal with the general topic of immunity and chiropractic. They also go on to say, quote, "The credibility of the review, which is the WFC review, should be questioned even further because some of the authors are known critics and deniers of vertebral subluxation theory and clinical practice," unquote. Not even sure what that means. What about the legality of what a chiropractor can or cannot say? Let's use the example from the California Board of Chiropractic Examiners in response to vaccines. There was an emergency regulation posted in 1993 after a Wall Street Journal article exposed some chiropractors recommending to their patients that they not vaccinate their children. The regulation stated it was unprofessional conduct to advertise or actually substitute a spinal manipulation for vaccination, treat a patient for a communicable or an infectious disease, or advise patients not to immunize their children. Additionally, policing of social media has been a priority in one province in Canada. The study aimed to evaluate the novel use of internet analytics by a Canadian chiropractic regulator to determine their registrants' compliance with 3 regulations related to specific health conditions, pregnancy conditions, and more recently, claims of improved immunity during the COVID-19 crisis. Regarding COVID-19 related words, 97 inappropriate mentions of the word immune were detected from 1,350 registrants, with 7 cases of noncompliance. And here's an example of probably a well-intentioned chiropractor posting, quote, evidence that we've just examined as not actually being published. The references used in the paragraph shown are not the studies discussed, but simply the mention of them historically. But again, these studies were never published. They go on to state, quote, "By removing the nervous system dysfunction, spinal adjustments can help improve immune system function," with 2 references. But look at these references. They're both theoretical without scientific verification in any published form. Now let's discuss what epistemic responsibility is. It's the philosophical term given for the responsibility for our beliefs. We can delude ourselves into thinking our beliefs and then related choices affect only us, but it takes little effort to list exceptions. And for healthcare providers, that's your patient. So it's your right to have an opinion, but what is the support for that opinion, and do you have a responsibility to be informed, or simply have a gut feeling? If there's no support, it's a belief. In particular, when the well-being of others is under your influence, you have to think about how you think. Consider your biases, your reactions, and tradition. Be wary of the belief that your beliefs are your business, your personal right. Even holding a belief without expressing it influences behavior, which potentially affects others, and certainly affects your actions, which does affect others. As we've seen, having a belief, which is an opinion without the need to support, influences your discussion with your patient and then their choices. So the question is, what can we do for patients using what we do know has strong evidence? What we know about higher risk of acquiring COVID-19 and dying from COVID-19 is that chronic disease is highly associated with increased risk. This includes diabetes, cardiovascular disease, and obesity. In a recent publication by Public Health England examining excess weight and COVID-19, one study demonstrated that with a BMI of 35 to 40, the risk of COVID-19 increases by 40%, and with a BMI greater than 40, increases by 90% compared to non-obese individuals. So I'll leave you with a question. So why not change or emphasize our focus on a healthy lifestyle, including diet and exercise, instead of hoping for a relationship between manipulation and immune response?